Bipolar 1 versus 2, which is worse? I'm Dr. Tracey Marks, a psychiatrist, and I publish weekly videos on mental health and self-improvement. Today, I'm going to be talking about the difference between bipolar 1 disorder and bipolar 2 disorder and address the common misconception that bipolar 2 is a milder form of bipolar 1 and therefore probably less of a problem. Bipolar disorder is a mood disorder and it has two states, depressive episodes and hypomanic or manic episodes. And manic episodes are defined as the following, and I'm going to read this because it's just too many words. And it's taken from our Diagnostic and Statistical Manual of Mental Disorders, the 5th edition. Here we go. A period of abnormally and persistent, elevated, expansive, or irritable mood, and abnormally and persistently increased activity lasting 1 week and present for most of the day, nearly every day. And then you have to have 3 of the following, or 4 if your mood is irritable instead of elevated. Number 1 is inflated self-esteem or grandiosity. 2, decreased need for sleep, more talkative than usual, or pressure to keep talking. Number 4, flight of ideas or racing thoughts, distractibility, increase in goal-directed activity or psychomotor agitation, you just can't stop doing things, excessive involvement in activities that have a high potential for painful consequences, such as things like going on buying sprees or getting involved in business investments. Sometimes people become hypersexual. Also, the symptoms cause clinically significant distress or impairment in various areas of your life, not just one little area. Hypomania has the same symptoms, except they only need to last for 4 days instead of a whole week. Another main difference is that with hypomania, the symptoms don't cause any real impairment. And in other words, you're still pretty high functioning. Now, the second part of bipolar disorder would be to have depression or depressive episodes. And I've talked in previous videos about depression, and I'll put a link in the corner for you to reference if you want to watch that video. So bipolar 1 would be having episodes of mania and depression. Bipolar 2 would be episodes of depression and hypomania. If a person has delusions or any other psychotic symptoms, it's automatically considered mania versus hypomania. Because with hypomania, there's no impairment, there's a good chance that if you have bipolar 2 disorder, that you can go all of your life and never be put in the hospital because of your bipolar disorder. But with bipolar 1, it's very hard or pretty uncommon for someone with bipolar 1 to never have a hospitalization because the manic episodes tend to be pretty destructive. Now, knowing that, it's easy to conclude that bipolar 1 disorder is much worse than bipolar 2 because the manic episodes can cause a lot of problems. It's kind of like a tornado ripping through, and then you've got to clean up all the damage. But the reason bipolar 2 is not merely a milder form of bipolar 1 disorder is because people with bipolar 2 tend to have a more chronic course to their illness. They also tend to spend more time depressed than the people with bipolar 1. So bipolar 1 may be more intense, but bipolar 2 can be more chronic and persistent. Also, the number of lifetime episodes of hypomania and depression tend to be more for the person with bipolar 2 than the person with bipolar 1. So did you get that? People with bipolar 2 tend to have a more recurring episodes of depression than the person with unipolar depression even. So in many ways, although bipolar 2 disorder may be less intense, when it comes to the mania at least, it can just create more overall dysfunction in the person's life because of the lingering and recurring depressive episodes. Now, I said all this because I think in the past, we as clinicians have tended to think of bipolar 2 disorder as not really that bad, and that's kind of trickled down to patients in the way that they even think about their illness, and may even feel like you don't really need to get treatment for it because it's just not that bad. And I think this is because we tend to focus on the intensity of the mania and seeing that as more the thing to keep under control. But depression can be pretty debilitating, and we're not talking about like a hypo-depression. There's no such thing. The person with bipolar disorder will have not as severe of a manic episode, but they can have very severe depressive episodes. So the depression can be a big problem and a reason to continue in treatment and to maintain regular treatment to prevent the bottoming out episodes with the depression. And a good medication regimen can help reduce the overall burden of the illness by lessening the symptoms and maybe even decreasing the number of recurring episodes that you have over time. Thanks for watching. Leave me a comment if you have any questions, or even if you don't have any questions, leave me a comment just to say hi.